my name's Carly, and today I'm going to talk to you about the NREMT exam. I know that the very mention of this exam can cause some palpitations, some sweaty palms, some anxiety, some nausea, and I know because I was in your shoes not that long ago. So today I want to talk to you about some tips and tricks you can implement when you're taking this exam. Now, it's important to know that obviously the best way to succeed in this exam is to study throughout your program. Things like EMTprep, where you can go through some study guides, do some multiple choice exams, watch some skill videos, and real life practice is going to be the best way that you remember and apply this information, because it's more important that you're a good provider than a good test taker. Having said that, I know that multiple choice exams can be tricky and overwhelming for even the best providers. So let's go through some ways that you can succeed at this exam. First, it's important to understand how to break up a question when you're reading it. You need to identify the stem or root question. Basically, what is this question really asking of you? Then you need to be able to pick out distracting information. Distracting information is those bits of information the question has thrown in to sort of overwhelm you or draw your attention away from that main question. Answer options can also be distracting because they can appear correct or plausible, or they might even be correct, but they are not the best choice or really what the STEM question is asking. So when first reading a question, again, you identify the STEM question, pick out the critical information, identify distracting information, and then ultimately you'd want to be able to come up with an answer yourself before you even read through the answer options. If the answer you've come up with in your head is one of the options, that's great. Select it and then read through the other answer options to make sure you haven't missed something. So to start, I'm going to give you a question and we'll go through it together. This would be an example of a basic or perhaps even an advanced question that you would find on the NREMT exam. We'll go through a paramedic example later. However, anyone along the whole range of providers can learn something from both of these examples. The question is, you arrive on scene to a soccer game where many parents appear frantic. Your patient is an 8-year-old boy who is playing the second half when he began to wheeze and get short of breath. The boy is able to utter "I can't breathe" one word at a time and is seated in the tripod position on the bench. The mom reports that this has happened before when he was playing flag football. What should your first action be? A, provide an IM dose of epinephrine 1 to 1,000. B, initiate rapid transport. C, perform a finger sweep, and if unsuccessful, place an OPA and begin to provide PPVs. Or D, initiate oxygen therapy and prepare a nebulized albuterol treatment. So in the above question, first, like I said before, we're going to identify the STEM, pick out critical information, and weed out the distracting information. It's also important to understand that in the STEM question, for this question, for example, it's asking you what your first action should be. That's the STEM, first action. There might be other answer options that are important in your treatment. However, they're not the best first treatment. So now that we know what the question's asking, what's your first action, we can identify the critical information. First, we read that we're at a soccer game where parents are appearing frantic. This is a really good way to make you feel anxious right from the start. So set it to the side and focus on your patient. We know that our patient is an 8-year-old boy who was playing in a game and began to wheeze. The fact that it's the second half and that he's already been playing, that there's a bunch of people there, that doesn't matter. Him wheezing is a symptom that we want to identify and recognize and treat. The fact that he is uttering "I can't breathe," that he's in the tripod position, all of that helps paint a picture of how severe his condition is, but it's pretty clear that if he's wheezing and parents are appearing frantic, that it's probably a high stress scenario. Lastly, the mom reports that this has happened before when he was playing flag football. So he was being active when this happened before. Of course, it would be very helpful if they told us what happened last time, how they treated it, if there was a diagnosis, but that's not given to us. So we need to draw some conclusions based on the information given. Leaving you wondering what happened is just a way to distract you and cause you to burn more time that you don't have. So at this point, having read the question, identified the STEM and the important information, you should be drawing some conclusions and perhaps coming up with an answer on your own. However, I'm going to take you through this as if I don't have a guess as to what's going on with the patient. We'll read each answer option and identify which one should be most correct. Okay, the first answer option is to provide an IM dose of epinephrine 1 to 1,000. Okay, so what do we know about this? We know that 1 to 1,000 is an appropriate concentration for the dose epinephrine, or epi. We also know that epi can be given IM or intramuscularly, especially in anaphylactic reactions. So we can't really rule this question out based on the medication itself, the concentration, or the route. We also know that epinephrine, as I said before, is typically used in an anaphylactic reaction. So in this case, if the boy was stung by a bee and was allergic to bees, this might be a completely appropriate option. So we can't really even rule this question out just yet. What we do know is that the boy is wheezing. Wheezing is indicative of a lower airway obstruction. Typically, we might hear some stridor or upper airway obstruction issues with swelling caused by something like anaphylaxis. So while it's still completely plausible, this may not be our most correct option. However, we'll keep it in the back of our minds just in case. Answer B is to initiate rapid transport. Again, this is a great distractor option because it's something that we probably will and should do down the road. However, when a child is having a breathing issue, this needs to be addressed first. ABCs, airway, breathing, circulation. So if there's something that we can do quickly on scene or even in the back of the ambulance to address or fix this problem, we should do that first and then initiate our rapid transport. C is to perform a finger sweep, and if this is unsuccessful, place an OPA and provide PPV or positive pressure ventilations. This answer should probably strike you as a little bit of overkill and possibly dangerous. Performing a finger sweep on any patient who is not choking, especially if you cannot visualize the object, is dangerous. And for someone who's already short of breath, this is probably just going to cause more discomfort and more stress breathing. Placing an OPA in a patient who is conscious and trying to move air is also probably going to cause gagging and will further interrupt his own ability to breathe. Providing PPVs or positive pressure ventilations at this point is probably also a little bit of overkill. His problem is not the mechanical ability to move air, but rather perfusion because the lower airway is constricted. So we'll probably just eliminate that option altogether. The last answer option is to initiate oxygen therapy and prepare a nebulized albuterol treatment. With a child who's struggling to breathe, although we're not given any of his vitals right now, we know that giving some oxygen will probably lead to at least a little bit of soothing for his anxiety and stress and may help decrease his stress and his poor perfusion. We also know that albuterol is a beta-2 agonist. This means that it can cause bronchodilation or opening of those lower airways. This is exactly what we want. We want relief of those lower airways so that more oxygen can be moved in and out. We also know that albuterol is commonly used for asthmatics. Taking what we know about this patient, that the last time this happened, he was also being active, we can deduce that this is most likely exercise-induced asthma, so albuterol would probably be a great solution for this patient. Having gone through all the options, providing oxygen and albuterol is most likely our best option. It's the most correct answer, and it would be the appropriate selection for this question. So just by dissecting that answer, even if you didn't have a go-to answer in your mind right away, this should help you weed through those questions, even when some of the other answer options appear correct. Okay, now I'm going to take you through a paramedic example. Again, everybody from basic, advanced, paramedic, and beyond should be able to gain something from this question. So let's go through it together. You're dispatched to a 28-year-old female complaining of dizziness. You determine that the patient is stable but anxious and showing SVT on the monitor. Your first course of action is A, vagal maneuvers or having the patient bear down, B, synchronized cardioversion, C, synchronized pacing, and D, 6 milligrams of adenosine followed by an immediate 20 cc saline flush. Now I do want to point out this is actually an example taken from our EMTprep website. So head on over there next if you want more practice with questions like these. So in this example, there's not that much distracting information. We have our patient, a 28-year-old female. We have our chief complaint, and she's saying that she's dizzy. And we also know that we have SVT or supraventricular tachycardia on the monitor. However, she's stable. So that's a really important piece of information to identify. There's not that much except for the STEM question, which is what is your first course of action? Now we'll go through the answer options. First, vagal maneuvers, synchronized cardioversion, and adenosine are all part of your SVT treatment protocol. So review that in your head before you even read through the answer options. Pacing is not something we use for SVT. It's typically used for bradycardic patients, so we can eliminate that right away. Next, we'll consider those three options. With a stable patient, our first course of action is always the least invasive course of action. Consider BLS before ALS. Again, this algorithm changes a little bit if the patient is unstable. For this patient, synchronized cardioversion, or placing pads on a patient's chest and delivering some electricity to sort of restart the heart, is an option. However, as you can imagine, delivering a shock to someone is a little bit invasive and uncomfortable, especially if the patient seems otherwise stable aside from being a little dizzy. Adenosine is a chemical way to sort of restart the heart, slow the rhythm, and try to reset normal sinus rhythm. Again, this involves an uncomfortable situation where the patient's heart is stopped briefly, and it can make them feel a little anxious and uncomfortable. So this is another fairly invasive option. Last, we have vagal maneuvers, or bearing down. This involves something called a Valsalva maneuver where we bear down, and then the hope is to stimulate the vagus nerve, which can sort of naturally slow down the heart. While this is not invasive, it does involve sort of a deft coach who can accurately explain and work with the patient through this maneuver. So if you have the ability to talk someone through this, which any paramedic provider should, this would be the best first course of action. Again, if this patient's condition changes to unstable, if she goes unresponsive, or starts having other symptoms, you're going to want to resort to a little bit more invasive of a procedure. However, having considered all the possible options, vagal maneuvers would be the best place to start, see if it corrects the problem without having to introduce electricity or other chemical helpers. So obviously the hope is that you can come up with answers on your own after reading the question. However, sometimes that's not going to happen. So the ability to weed through answer options is helpful. It's also good to know that not all your answer options are going to be scenario-based, or not all your questions will be scenario-based. Sometimes it's just going to present a simple question with a simple answer, and you just know the fact or you don't. So for that, studying is obviously very helpful, and being able to make some educated guesses. Anytime you begin an exam like this, it's important to have a systematic approach. So keep that in mind. Now I'm going to go over some other helpful tips when you're taking this exam. First, beware of questions or answers that contain always or never. Now, this is not to say that an answer is automatically incorrect if it contains this verbiage, but just be aware that always and never are very bold statements in healthcare, in EMS, or really in life. So be aware that when you're going through answer options that contain always and never, it really does always or never happen. Next, time management is being tested. Time management is being tested not just on this test, but in your career. Your ability to take in information, dissect it, and make a call for patient care is really important. So for that reason, NREMT does not allow you to move backwards, and you can't really dwell on any one question too long or you will run out of time. So keep that in mind. Read the information, make sure you're reading it accurately, read through the answer options, make a selection, and don't look back. You need to keep your eye on the time. Another important thing to remember is that for basics and paramedics, this test, for specifically the NREMT, is adaptive. So it's sort of going to pinpoint and hone in on your weaknesses. If you notice you're being asked the same question in different words or the same types of questions over and over and over again, you may want to reevaluate the answers you're giving. Again, it's not a guarantee that you're answering incorrectly. Often, this exam will throw in pilot questions or questions that aren't actually counted towards your grade, but that they're sort of testing out to see if they would be appropriate to include in the exams for future candidates. But it is a good indicator if you get these same questions over and over and over again to at least reconsider your education, what you know and what you've learned, the question itself, and how you're answering. Look at all those little details, put them together, and answer the question the best you know. For advanced candidates, there is a set 135 questions. Basics, it will range from 70 to 120. Paramedics, it will range from 80 to 150 because it's adaptive. However, for the advanced EMTs, it will be 135 questions and it's a non-adaptive exam. So keep that in mind. Some other logistical aspects of the exam are to make sure you're leaving most of your valuables at home or in your car. You will need your ID because you'll be fingerprinted when you get to the exam. Most of these sites, it's an electronic fingerprint and you'll need just your identification card. Sometimes the sites will provide lockers for you to store your phone, wallet, keys, but if you can leave some of this at home or in your car, that may be the best option. Your results will probably be available perhaps later that day or the next day. They're guaranteed within about 48 hours, but we've heard of many instances where students who take their exam in the morning have their results later that afternoon. Of course, it depends on the day and the testing center and all of that, but just know that you should start looking for your results rather quickly. Again, you're probably going to feel jittery, anxious, stressed before the exam, as you walk into the exam site, as you sit down at your test, but know this is normal. You'll probably be given a piece of scratch paper and pen, which can help you write out some of your thoughts. You will have to leave that there and give it back to the exam site, but just know that when you sit down, it's a good idea to take a deep breath, sit up tall, and trust your instincts. If you've studied for this exam throughout your whole program, you'll most likely do great. If you're watching this video the night before your exam, hoping that I'm going to give you some magical tip to pass your test, might be a little late. However, it is good to have a systematic approach and trust your gut, trust what you know. Your first answer is usually your best answer. So, I hope that this has been helpful for you to learn some information, some tips before you even start your program, as you're going through your program, or even if it's the night before you take your exam. Good luck.